Hello, everyone. I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery Faculty. And it's an absolute honor to be sitting with Rank 1 and Rank 2 in the recently conducted AIIMS SS exam in the minimally invasive surgery department. So I have Dr. Prakhar and Dr. Madhu. Dr. Prakhar secured rank 1, Dr. Madhu has secured rank 2. Heartiest congratulations to both of you. Why don't you give a brief introduction and then we can start discussing about your journey and how it can help others.
Thank you so much. Madhu, doctor, would you like to go on first?
You can start.
Okay, I'm Dr. Prakharanshu. I have completed my MBBS from Grand Government Medical College, Mumbai, and I have pursued my MS in General Surgery from SCB Government Medical College, Cuttack. Fortunately, I was awarded gold medal in General Surgery, and all credits goes to Rohan sir for that, for basics. And after that, I'm right now.
It's your hard work. My role is just the guidance part. It's your hard work which is paying off.
But that was also very much helpful, sir. And currently, I'm working in trauma surgery department in AIIMS Delhi.
Dr. Madhu?
Yeah. Sir, I have pursued my MBBS from JJ Medical College in Davangere. It's in Karnataka. And following that, I have done my surgical residency from Grand Government Medical College in Mumbai. And I want to express my gratitude now that for all the guidance and support and whatever you have provided through the videos and MCQs, I just want to express my gratitude and say thank you, sir.
Thank you. I think so. The entire Marrow team is proud of both of you regarding the achievement which you people have done, and that is what we would like to discuss further. And I am sure people listening to this would get influenced by your journey, and would inculcate some of the things which you've done during this course. So both of you were Marrow users. Both of you have seen the Marrow videos. Dr. Prakhar, I'm going to start with you. What was the inclination towards taking minimally access surgery? I know now you're going to join oncosurgery. You told me you've got a rank in NEET SS as well, and you're taking up oncosurgery. But why did you appear for minimally invasive surgery? Was it just because there was a lot of exposure in minimally invasive surgery during your residency? Is that one reason why students take up that branch? More often?
So to be frank, I was more oriented of MCH Oncos from my MS days only. But after my MS, I joined a trauma center in Delhi AIIMS, which is very hectic, and I was not actually getting time to read. So I wanted to appear for oncosurgery, but meanwhile I thought, okay, with my residual knowledge and whatever I have read, because I thought preparation for MIS was just an extension of NEET preparation. That is the main reason I appeared for this exam. Otherwise, to be very truthful, my first preference was on.
So just a casual walk in the park and you got rank 1. Amazing.
Actually, I was not getting much time to read, sir, actually. Yeah.
Great. What about you, Madhu? What was the inclination behind taking up minimally invasive surgery?
So the kind of exposure that you have got in our residency at Grant was really amazing, and I was just captivated by the precision and the overall outcome. So that's why I chose.
Okay. So Madhu, we'll start with you. When did you start using the Marrow SS plan, and how much time did it require for you to go through the videos? And what all did you supplement in addition to the videos which you watched on the Marrow app?
Sir, I have started it in my 3rd year. I just took down the notes from all the general surgery part of it only. I couldn't do the super specialty part. And I was able to go through it once before my MS exams as well. And that also helped a lot. And after that, after my MS exam, the actual preparation started from August, where I started doing the MCQs.
So the MCQs you were doing from Marrow, and you, as we were discussing before, you utilize certain resources which are specifically helpful for MIS. Can you mention those as well for the benefit of other people who want to take up this branch?
So I prepared from Sages Volume 1 and 2. And there's a other book for MCQ. It's by Dr. Kaushal and Kundra. It had
No.
around 1,500 MCQs that I solved. So
So in addition to the Marrow MCQs, you did MCQs from this book as well. And Sage's volume, how much time does one need to devote to this, these volumes to get a hang of them?
so it's pretty easy to go through it. Like I was able to finish it in 4 or 5 days, one volume. It's because I had that thing. Like I had just finished my MS, and the topics were similar. Like what we read for recent advanced paper 4, most of the topics are from there.
What about you, Dr. Prakhar? When did you start using the Marrow app, and how was your experience with it? Did you watch other specialty as well as you were interested in oncosurgery? You were
Yes,
saying.
sir. I watched all your videos, general surgery videos, twice, because once I was already watched in my MS first year. I
Okay,
borrowed with my friend, and then in third year I subscribed Marrow again, and I
right.
saw the general surgery videos, and also I saw the oncosurgery videos, and some part of gastrosurgery was wonderful, so I saw that also, especially the onco part of gastro I saw.
Okay,
And regarding the
perfect.
preparation of MIS, I would add on to Dr. Madhu. SAGES is definitely important, as I was also told by the seniors here in AIIMS. But again, I would like to say that around 50 to 60% question comes from the basic NEET preparation of Bailey and Sabiston. So even if we focus on them and we can just go through SAGES once, that would be sufficient. I think I don't know what Madhu would like to say, but I think that would be sufficient.
Yeah, I agree to you.
Yeah.
Okay, so
Most of the
I think
questions
so.
were basics.
I
Yeah.
think so. Everyone is on the same page that Bailey and Sebastin are a must. But during your MS days, Madhu and Prakhar, did you utilize other textbooks as well for particular topics? And would you like to mention those for the benefit of other MS candidates? Like, I did endocrine surgery when I was preparing or I was doing my MS from Schwartz because we were always taught that breast and thyroid is better in Schwartz. So, is there
Yes.
anything else which you would also like to highlight, both of you, from other textbooks?
Sir, I think the person should be very clear if he wants to go for INI or if he's wanting for NEET SS. If the
Okay.
plan is totally focused on NEET SS, I think Bailey and Sabiston should be done thoroughly instead of doing many other books. And to add on, if a person is preparing for trauma surgery MCH, which is also available at AIIMS Delhi, and MIS, then he can additionally read ATLS for trauma and SAGES for MIS, because I have cleared both, so I know questions comes from both these two things only.
Perfect. So I
Otherwise,
think
so
so
many
that
books are
is
there, you cannot just,
right.
yeah.
So I think so that is a very concise and a precise answer, which anyone listening to it can, gather insights from that answer. What about you, Madhu? Did you refer to any other textbooks during your postgraduate tenure?
So pertaining to MIS or just in general?
In general.
Sir, I read Bailey's and GI part I read from Sabi. That's about it. And Schwartz, endocrine I read from Schwartz.
Perfect. All right. Great. So let's come to the QBank in the Marrow app. Both of you utilize the QBank, and were you also appearing for the tests in the Marrow app?
Yes, sir,
Yes.
we did.
Okay. And
Although the
I mean,
questions,
would you think the questions were similar to what are asked in the SS exam? Also, what about the mock tests and the mini tests which were conducted? Can you please talk about them as well?
okay, I think I have not. I give few tests on Marrow. The
Hmm.
mock tests were, sir. I think that it was wonderful.
Hmm.
A little beyond the level that should be considered for NEET SS, but otherwise it was wonderful. I would agree with
Okay.
that.
Right. What about you, Madhu?
Yes, sir. I gave the mini test and grand test regularly.
Hmm.
And I felt like they were a bit more difficult than what actually came in the exam.
Yeah.
So that actually helped a lot, actually.
Okay. Perfect. So, Dr. Prakhar, you've appeared for NEET SS as well.
Yes, sir.
Let me ask this question from you. A lot of students ask me that the course is so vast. How do you revise it, 1 month or 15 days, 20 days before the exam? What do you actually revise as an MS candidate before the NEET SS exam?
Sir, actually, I had a habit of making shortcut notes in my iPad. I used to just save on a 2-page note, 5-page note for each topic. So I started my preparation back when I was in last year of my second year. So since then I have been revising, and then I started making small notes before exams. So at that, I think that was very useful and beneficial. If you can concise your notes in some small PDFs and revise at the end.
Okay. What,
Plus the Bailey images and charts, Bailey and Sabiston images and charts are pretty useful if you can revise at the end.
Fine. What about you, Dr. Madhu? How did you go about your revision before the exam, which is something which is very daunting for a lot of aspirants?
Sir, I watched the revision videos which you had put up. Like there were around 10 to 11 revision videos which I saw, and I had like made 5 notebooks I had of all the general surgery notes. So it was very easy to go through them.
All right. So
Actually,
basically,
initially it sounds very difficult to revise, but once you have concise your notes in the form of handwritten notes or in PDF whatsoever, it is not actually that difficult to revise at the end.
Okay. So one, I'll dive deeper into this. A lot of questions come from tables of Sebastian, and there are a lot of values also sometimes there. So how do you go about revising them? Do you really pay a lot of attention to those values when you're studying those tables, or you see which questions have been asked previously regarding the values and just remember those values?
I think I was not paying much attention to mugging up everything. I was just looking them every day. Like I had a habit of going through the charts and images daily. So it somehow, once you're marking the questions, you know that, okay, this is the answer. Somehow, that's my way of understanding.
Okay. What
you cannot
about
mug up
you?
all the values at the end.
Yeah. Madhu, would you like to add on to that?
Yes, sir. Sir, for the important values, I just made one page in my iPad and I just noted down only the important ones and went through it on the last day.
So I think so both of them have highlighted a very important point. I think so you need to start early, you need to watch the videos, make your notes and keep on revising. So the more concise you can make your notes and the more you can trim down as you're reading more and more, that is what is going to benefit you a few days, a few weeks, a few months before the exam, along with doing MCQs. And as has been highlighted by both the toppers, that Bailey and Sebastian are a must do. And for minimally invasive surgery, the SAGES manual, and for ATLS for the trauma surgery part.
Surgery. Yes, sir.
Perfect. So thank you very much, both of you, for sparing time and talking to me and sharing your views, which would benefit others. Before we end the interview, any final words of advice to an MS candidate? When should they start preparing? Because MS candidates always, when they enter first year, they are in a dilemma whether to pick up books or to just do ward work. What to do? So, what would be your advice to them during the 3 years of MS? Regarding preparation and how they should approach their MS. Dr. Prakhar?
Okay, so I would like to briefly say that first year nobody is getting much time, so you can just go with S-DAS or whatever practical book you want to read. The good time to start for NCH preparation would be enjoy for first 6 months of the second year, and then you can sit down and study for your MCH. So because it around takes 7-8 months to complete the entire videos and making notes and then revising, and then again you have MS exams along with it. So second year at the end you can start last 6 months, and I would like to highlight specifically reading, and the theory part is very important, but practicing more and more MCQs give the actual edge. So more you practice the questions, it will also help you to understand and remember the theory more efficiently rather than just revising the theory in form of the long text. So I would say start preparation early and do as many questions as possible. Use different platforms whatsoever is possible and get thorough with the MCQs.
Perfect. What about you, Dr. Madhu? Would you like to add on to that, please?
Sir, regarding when to start, actually that depends on how hectic the duties are. For me, I was posted in periphery in third year, so I started then. I think people should just enjoy their I mean, not enjoy, but they should just work hard in the wards and just learn the practical aspects. And whenever they get time, they should start studying for the entrance exams. And it's not as difficult as NEET PG entrance exam that we gave. It's quite easy as compared to that. And I think revision and grant tests are the ones which will give you an extra edge.
How often were you appearing for grant tests?
So I gave every grant test which came up in the recent grant test. Yeah.
Perfect. Perfect. So I think so. Sound advice from two toppers, rank 1 and rank 2 in the INISS exams. So I'm sure what they're talking makes sense for everyone. And both of them seem very approachable. So if you have any queries, you can always reach out to them and take guidance from them as well. Once again,
Definitely, sir.
heartiest congratulations from the entire Marrow team, and I wish you both all the very best in your future MCH programs. Thank you.
Thank you so much.
Thank you so much. Thank you so much, sir.